Okay.
Yes po.
All right.
Yes po.
Okay. All right.
Yes, very clear, very
Okay,
nice.
wonderful. Okay. So let's begin. So you have your face mirrors, huh? Okay. So you are not alone. This is a woman, and the globally accepted woman's lifespan is nearly 80 years. But it seems that this number has been increasing. My mother lived to 98. I'm sure some of you, your mothers have lived more than 80 years. So again, look at that face in the mirror or look at that face on your phone and tell yourself, hey, I'm 50 years old, whatever age you are in. And if you are 50, tell yourself that you have a whole lot of 20 or 30 years ahead of you. If you are 60, you have a whole lot of 10, 15, 20 years ahead of you. If you are 30 years of age, you have a whole lot of 50 years of age ahead of you. Why am I saying that? Because here you will see the different phases and phases that each woman goes through. Can you actually see yourself at which phase you're in? Are you a teenager? Are you a lola? Are you a geriatric woman? Are you into menopause, perimenopause? Are you in the childbearing stage? Or are you simply an adult, just beginning to become a woman? So I have to make you understand that each one of us, we have our own biologic clock. And each clock is programmed before birth. And it only sets off at a certain time in each phase. So iba-iba ang panahon natin. Kung kailan tayo magre-regla, kung kailan tayo magkaka-hot flashes, or simply when we will menopause. So as we tick away the time and the days in our life journey, let us recall the following. Here you see the circle of life. We will all go through this circle of life. Most of us, of course, have gone through infancy, childhood, puberty, childbearing. Some of us are into perimenopause. Some have menopause. Some are postmenopausal, and some are geriatric. So as we tick away the time and the days in our circle of life, let us recall, do you recall the time of your birth? The first step that you took, the first word, the first tantrum. Of course, you cannot remember that, but it was relived and told by your mother. What about childhood? Your childhood days. Do you recall when you were ready to go to big school, so excited to wear your new uniform and to meet new friends? And life then was just simple and playful. And then we come to the point where all of us have gone through the first and foremost milestone in our life circle, and that is puberty. It is a moment in time. Do you recall your first menstrual period? Do you recall your menarche? Menarche is the start of your menstruation. And it must be emphasized that puberty sets the time for the long phase described as the following years of childbearing, reproductive years of about 30 to 40 years. If you started your menstruation at the age of 10, you have a long reproductive year period of 30 to 40 years. Just a little biology 101 for you to understand and maybe a helpful guide. A shout out to young mothers, to those who are currently grandmothers, and to those simply stage mothers and lolas out there. Here you will have the female body, which consists of the female reproductive system that consists of the internal structures and the external structures known as the vulva or external genitalia. The internal structures are the following: your uterus, your cervix, your fallopian tube, and your ovaries. It is important for me to emphasize, at birth, our internal reproductive system remains at a halt. It is paused until it becomes fully functional only during puberty, that is, at the start of our menstruation. Let me emphasize that we were born only with a certain number of eggs during our lifetime. Unlike men, sperms are continually being produced, while our eggs are no longer reproduced. So tandaan niyo yun, we were only born with maybe hundreds of thousands of eggs. But in our whole lifetime, we will only use up about 400 eggs. Okay? The ovaries are the main source of the two female hormones, namely estrogen and progesterone. When we start to menstruate, each month during our childbearing years, the uterus has no other function except to prepare itself for a possible pregnancy. Okay, that's all it does. The main function of our being a female comes from the ovaries. And the ovaries, again, produce these two hormones, estrogen, which is secreted during the entire menstrual cycle, and it actually helps prepare the uterus, okay, to become the bed for a pregnancy should an egg that is actually released from the ovary into the fallopian tube and becomes fertilized by a swimming sperm into the uterine cavity. Now, progesterone, on the other hand, is produced by the ovaries again only after ovulation. Remember, ovulation is that process where the egg is released from the ovary. Your progesterone is produced only after ovulation, and should there be fertilization of the egg in the fallopian tube, if it gets fertilized, the progesterone becomes the support for the uterine lining for the fertilized egg to grow in. If, however, the egg is not fertilized, no fertilization takes place, what happens? Menstrual period ensues. So, to regulate your menstrual cycle, the two hormones, estrogen and progesterone, must be balanced and must have a regulatory interplay of its function. So, during your childbearing years, do you recall your childbearing years? This would include your college years, the start of your career, romantic relationships, the wedding, marriage, family life, and simply raising a family and taking care of your kids and your husband. All of these are rolled into one package during this red part of your life circle called your reproductive years. Whether you're single, studying, these childbearing years are crucial until you reach that point where you ask yourself, how good has your life been? And what else can you ask for at this point? Is the quality of life the life you actually dreamed of? Take note, if the circle of life is you've actually filled up half of the circle of life, is it actually true that at this point you can just say and tell yourself, what a good life I had? And if the expectancy life cycle is at 80 years, you still have a whole lot of 40 years. But truly, how good was your quality of life at the age of 40? Do you agree that the old cliche, life begins at 40, is true? This was actually coined by the American philosopher Pitkins, who described that the years of 40 are the years of accomplishment and productivity. It means that you have accomplished so much that after this life, after this period, life becomes better. And because you have evolved into your own skill set and very good experience, now it's time to sit back and enjoy life. And you just have so many years to just look forward to the enjoyable and prosperous years after spending 30 years back over now that you have reached 40. But truly, ask yourself, do you really have a good life now that you are at 40, 50, 60? Women go through a phase called midlife, and it is dominated by anxiety, forgetfulness, and even fatigue. They call this the natural stage in a woman's life. It is supposed to be as natural as when you start your first menstrual period, and it is complex and puzzling as the start of puberty or even the start of adolescence. Each of us will go through this transition phase of 15 to 20 years, and this is what we call the climacteric transition phase. And it begins on the left side of the circle of life from perimenopause, menopause, and postmenopause. Your climacterium is the phase where there are ongoing changes, symptoms, concerns, issues that each woman will actually pass through, go through, or will survive through. There are actually 3 stages of menopause. Yes, to better understand these changes, let us understand the terminologies often used by women. Strictly speaking, menopause means the end of menstruation. It is a moment in time. It marks the end of the woman's reproductive years. If menarche is the start of your menstruation and the start of your childbearing reproductive years, menopause, on the other hand, is the end of your menstruation and the end of your reproductive years. And so, you must remember Menopause is a moment in time. It is a culmination of a biological process, and it is only confirmed by the absence of menses for a period of 6 months to 12 months. So kung hindi pa tumigil ang regla nyo, hindi pa yan menopause. Those who are still menstruating, okay, belong to the phase called perimenopause. It is the years before menopause, about 5 to 10 years before your final menstrual period. And this can start between 40 and may end up to about 55 years. And your perimenopausal phase can last for about 4 to 8 years. Postmenopause, on the other hand, overlaps with the end of your perimenopausal phase. Remember, your perimenopausal phase is long, can be 40 to 55. So that could really last for 15 years. And postmenopause may actually overlap with the end of your perimenopausal phase and extends into the years after your last menstrual period. So to summarize and to make you understand better the terminologies, perimenopausal means you are still menstruating, but you experience menopausal symptoms. Menopause, you no longer menstruate for at least 1 year. And postmenopause, you no longer menstruate. However, you run the risk now of serious heart and bone problems. Why does it occur? And is this natural? As one goes through life, here, the body, you will notice, will gear towards pregnancy and childbirth. But during the climacterium, that is the yellow phase in the circle of life, the reverse happens. Your reproductive system is gradually now winding down. Beautifully when you started menstruating, grumpily when you're in the midlife, and you feel so sullen and despondent postmenopausally. Your reproductive system is gradually winding down. Furthermore, as I did mention, in infancy, we were born with a certain number of eggs. We no longer produce more than the eggs that we were born with. When you reach puberty, of course, ovulation now takes place. An egg is always released during ovulation, during a menstrual cycle. However, during your childbearing years, take note, only a few hundred of eggs actually reach maturity and are released in the fallopian tube during ovulation. The rest are resorbed back into the ovaries. And sadly, beginning early, mid to late 30s, the number of eggs present in the ovaries start to diminish further, and the ovaries will start to produce less hormones, estrogen and progesterone. And this is evident by the fact that there are irregular menses, diba? There are changes. Sometimes you will have cycles that are not ovulatory, so you will not be producing estrogen. So there's usually an imbalance in the interplay of the functions of your estrogen and progesterone. And the hormones will fall even dramatically when you enter perimenopause. And ovulation sometimes will not occur and will result in irregular menstrual cycles. And even more when you approach menopause, because your eggs will start diminishing less and less, your menstruation will stop. So to summarize, your depleted functioning eggs, you have ovulation that will stop, your estrogen levels will decline, your menstruation will stop, and therefore you become menopausic. Let us start with the first scenario of, I'm going to share with you cases for you to better understand. Case number 1 is a perimenopausal woman. She's 43 years old, mother of 2 kids, with irregular menstrual periods, high anxiety level, roller coaster moodiness with occasional hot flashes and night sweats. She has trouble sleeping, noticeably weight gain, vaginal discharges with occasional itchiness, and she forgets where she leaves her eyeglasses. Does this remind you of anyone? Anyway, what are the early signs of perimenopause? Each woman's experience of menopause is different. Many women will report no physical changes during menopause, except for irregular menstrual periods. And then until the time when the periods will stop and menopause is reached. Women will sometimes, like this woman, 43 years old, she has occasional hot flashes, but her main complaint is irregular menstrual cycles. Her menstrual flow becomes lighter or sometimes heavier, and it becomes less and less predictable and becomes sometimes more profuse and prolonged. This is because of the diminishing number of eggs that are producing cycles without ovulation, and therefore causes the imbalance of your estrogen and your progesterone. Women in perimenopause transition into menopause, and 2/3 of these women experience hot flashes while they are still menstruating. Hot flashes is the most common menopause-related discomfort. They involve a sudden heat of wave heat or warmth, accompanied by sweating, reddening of the skin, and rapid heartbeat. It usually lasts for about 1 to 5 minutes. And usually the hot flashes are frequently followed by a cold chill. So this is actually the vasomotor symptoms and very commonly seen in women in the perimenopausal phase. Long time ago, they used to say that hot flashes is all in the mind. Parang psychological lang. But no, there is a reason for this. Hot flashes, which is normally felt in the morning, and night sweats, which are the nighttime counterpart, they result from insults in the blood vessels underneath the skin. The woman with hot flash will have her blood vessels dilated so that the skin becomes swollen and red. And then all of a sudden, they just feel, they perspire profusely that runs down from the face up to down to the neck and to the back. And when this happens, the skin temperature rises. And when the skin temperature rises, the heart beats faster. And the woman experiences a palpitation. Immediately after the flush, you will see now the blood vessels will constrict and will cause the skin now to be pale and thin, and the sweat evaporates, and the patients now will feel a sudden cold and will shiver. And a hot flush episode will normally last anywhere from 5 minutes, and some women will really feel sweating the whole body and may last for 20 minutes or even longer. Suffice to say that 75% of all women experience hot flushes within a year after the last menstrual period. The hot flushes will tend to become worse in frequency and duration and continue to occur for the next 5 years. Now, night sweats, which are the counterparts of hot flushes at night, okay, what happens, it interferes with sleep. While it is a myth that menopause itself makes women irritable, okay? Sinasabi nila, irritable, masungit ang mga nagme-menopause. Guilty ako dyan. It's probably because of the sleep disturbance that stems from the hot flush or the night sweats, which make the woman irritable at night. Kasi if you're not able to sleep, you're not productive. You become anxious. You become irritable. So the treatments for night sweats and hot flashes include a lifestyle change. You can take non-prescription remedies. You can take phytoestrogens or alternative plant estrogens, or you can just actually simply cool down, avoid alcohol before you sleep, or you can take a cool shower before you sleep. All this can actually relieve the night sweats and the hot flashes in the morning. Now, you can differentiate night sweats responsibly by menopausal women, or night sweats that is a symptom of stress. Night sweats, okay, if you have night sweats at night, but you don't have hot flush in the morning, that could be a symptom of stress and not actually a hot flush. Remember, hot flush counterpart are night sweats. They come together. But if you don't have a hot flush in the morning, but you have night sweats at night, that's most likely a symptom of stress. Okay. Now, so the classic symptoms associated with perimenopause are your, again, hot flush and night sweats. But this seems to be incapacitating all of us, okay? But we are not only incapacitated because of the physical symptoms, but because of emotional and mental behavior sometimes. Okay, what happens to us? Did you ever wonder why at times you missed an appointment or you missed a schedule with a friend or even an event? Have you even experienced that you have misplaced your cell phone or even yung salamin nyo, your eyeglasses, yung pala nasa tuktok ng ulo nyo? Or do you have difficulty concentrating or focusing? Now, although these symptoms, these emotions, these behaviors can occur at any age, they rarely occur together. However, if you experience several negative feelings and these emotions and behavior that I explained to you now simultaneously appear in your life, it is most likely because of the natural culprits, menopause and aging. It is important to understand that estrogen has at least 50 actions in the brain. The lack of estrogen in the brain, the lack of estrogen may cause a decline in the neurotransmitter called serotonin, which boosts the mood. Okay, so a lack of estrogen will result in mood swings and depression. So the changes in your hormone levels may influence the presence of your serotonin in the brain. And so you may not only have hot flashes or night sweats, but you can also, the drop in your estrogen can lead to anxiety and to mood swings. So if you experience symptoms of depression nearly every day, 2 or more weeks, you might be depressed. Okay. Estrogen receptors also are present in the brain that control the hippocampus, or that part of the brain that is responsible for memory. And so if there is a drop again in your estrogen levels, we may experience this confusion or sometimes forgetfulness. Another part of the brain that is also estrogen dependent is the amygdala, which is responsible for the psychological well-being and sexuality. This is important because any drop again in your estrogen levels may decrease libido and may lead you to having low self-esteem, low sense of well-being, and of course, low sexual drive. So the menopausal moods that you experience will resemble a roller coaster ride, where the mood swings from elation to despondency are very common. Sometimes tasks that used to be easy to handle now leave you in total disarray. Iiyak na lang kayo kasi you just get frustrated. And I am sure many of you have experienced this or are experiencing this right now. Sometimes women will even describe subtle sensations of trembling. Hindi nyo naiintindihan bakit kayo nanenervyos. You can't understand why you are feeling uneasy. And sometimes you don't understand why biglang wala kayong ganang pumasok, para kayong nilalagnat, like you're just having a fever when in fact you're not even sick. And the most important, sometimes your patience is exhausted to the point little things you snap at the click of a finger. And the worst is when you lose your self-esteem. That becomes precipitous and you feel depressed. And these physical symptoms of mental anguish, hot flashes with palpitation, can appear like anxiety attacks. And the night sweats can add on to this feeling and disrupt your sleep. And then it becomes a domino effect. You become irritable, you become anxious, you become depressed. So what do we do? Okay, we'll get into that. What else do you experience? I talked about the early perimenopausal. There are women in the late perimenopausal phase, okay, where the decline in estrogen is not only seen in the vasomotor symptoms of the skin or in the emotions or in the behavior, but also in the external reproductive system, not only in the internal reproductive, but also in the external genitalia. Let us not forget, the external female reproductive system is your vulva. And normally, the effects of the decline in estrogen that has effects on the genitourinary system are found in the late perimenopausal phase. Okay, just a little anatomy. We have two V's the vulva, which is the external genitalia, which is composed by your labia majora, labia minora. In the midline structure, you will find your clitoris, the urinary opening, your urinary bladder, and your vaginal opening. It is important to understand the vulva because many women think that this is the whole vagina. No, the vagina is a muscular canal, it's a muscular tube found within the internal reproductive system. And it suffices to understand that the vagina has its own life. So this is your vaginal canal, okay? So do not get confused. The first V is your vulva, the second V is your vagina. So your vagina is found internally, connected to the outside of the body through the vaginal opening. Your vagina is a structure that plays a very important role in sexual behavior, menstruation, and childbirth. Why am I bringing this up to you? Because it is important for you to understand. As you go through menopause, your vagina is also going to be affected. The vagina has its own life. It has its own ecosystem. And it functions independently from the other female reproductive structures. It is important to understand that estrogen plays a very important role in the life and the optimum physiologic function of your vagina. Estrogen that lines the vaginal cells ensures of it as a food substrate for the currently naturally occurring lactobacilli found in our vagina. As we speak, we have lactobacilli naturally occurring, but this also becomes depleted when you move towards the menopausal phase. So if your vagina, okay, which is lined with estrogen, and you have a full set of your good bacteria, lactobacilli, to feed on, what happens? Lactic acid is a substrate or is a substance that becomes the byproduct where your lactobacilli feed on your estrogen-lined vaginal cells. And the more lactobacilli present that feeds on these cells, the more lactic acid is produced and the more acidic the pH of the vagina becomes. It is important that the vaginal pH is acidic because it prevents any infection, any inflammation, and prevents vaginal dryness. Okay? So that's a little under information. Okay? Now, take note that the vaginal pH value is different in the different phases of a woman's life cycle. In the newborn, the vaginal pH is high, above its acidic level because you don't have estrogen. Your newborn has no estrogen at that time. The girls, the young ladies, young girls, 5 to 7 years of age, their pH, the vaginal pH is even higher because remember, at birth, your reproductive system is at halt until such time when the girl now starts puberty and starts menstruating, you will notice that the vaginal pH now will start decreasing until such time she reaches the childbearing and the reproductive years where the vaginal pH is at its minimum or optimum of anywhere from 3.5 to 4.5. What happens during menopause? Because now that there is a decline in your estrogen levels, your vaginal pH now becomes less acidic and more alkaline at 6 to 7. So again, in summary, reproductive period, onset of menarche, there's estrogen stimulation, your pH balance is 3.5 to 5. This is seen in pubertal women, ladies, childbearing, reproductive years, up to your perimenopausal phase. If this is your vaginal cell, here you will find good lactobacilli, the yellow faces, more than the bad bacteria, because your vaginal pH is 3.8 to 4.2. In the post-reproductive period, that is menopause, post-menopause, geriatric, menopausal women, the pH is more than 5 because of the declining or absence of your estrogen levels. Inside the vaginal cells, you will see less of your lactobacilli, your good bacteria. You will have more of the bad bacteria. That's why sometimes you have vaginal discharges, you have inflammation, and you have vaginal dryness. So let's go to the second case. A 49-year-old, 95-pound woman, a chronic smoker. She presents with extreme night sweats. Husband complains that the room is too cold kasi tinatapat na nga niya yung aircon, may electric fan, so giniginaw na yung asawa. Menstrual period now has ceased over a year, so that puts her at the menopause phase. There is occasional burning sensation in the vagina, late perimenopausal phase, painful sex, disinterested in sexual relations, extreme roller coaster mood swings. She admits to be more recluse and a social hermit. She feels like she's a candle burning slowly without energy. She frequently visits the toilet at night. Now she occasionally feels muscle aches and pains. And now she cries for no reason at all. Where is this woman? This woman is really at a crossroad. She is, menopausic. Okay. She has passed through perimenopause. She has many changes that are not only caused solely by menopause, but the changes that she is experiencing now is a result of a mix of menopause and aging. While some of this is due to aging alone. And because now she has stopped menstruating, she is moving into the post-menopausal phase. So she's menopausic. She's 49 years old. The average of menopause is 51 years, but it can occur in the mid-40s to the mid-50s range. Our patient is 49 years old. The factors that trigger the onset of menopause. She is a smoker. Smoking influences the onset of menopause. Smoking decreases the secretion of estrogen from the ovaries. Nicotine activates the enzyme in the liver that metabolizes the sexual hormones and speed up its rate of removal from our body. Nutrition is significant. This woman is 95 pounds. Undernourished women start menopause earlier than those well-nourished. Women who weigh more than 60 kilos, 135 pounds, tend to experience menopause at a later phase than those who weigh less. Why? Because women who have more weight, have more fat, has more estrogen. They have what we call the inactive estrogen, known as estrone, that can actually produce a little more of the estrogen stimulation and may result in longer menstrual cycles. Okay. Now, I would like to tell you that there are some women, less than 1% of women, may experience, however, menopause before the age of 35. And we call these women premature menopausic, and this may happen in possible cases of thyroid dysfunction or any thyroid disease. And there are some women who we call surgically menopausic, when their ovaries are removed during the perimenopausal phase, even before menopause sets in. Now, our patient, or case number 2, said that she cries for no reason at all. But that may not be necessarily because of menopause. Menopause per se is not associated with depression, but may coincide with stressful events and circumstances that trigger the depression. And these are examples: grown children leaving home, we become empty nesters, or elderly parents who need care, where it becomes a stressful event to take care of our aging parents, or changing relationships with your partner. Maybe you were separated for a period of time physically because of work reasons, and then you all of a sudden got together. The changes in behavior and emotions also become a stressful event. And sometimes midlife career change. Sometimes you probably were promoted. You became not only a manager, now you became a vice president. So the stress of work actually will produce this kind of event, and you might blame this on menopause. Okay, so these are just samples that you might think it is because of menopause, but this is because of the stressful event of the crossroad of menopause and aging. Okay, so again, what are the symptoms? Physical symptoms: early perimenopause, hot flashes, night sweats, anxiety, mood changes. Remember, the brain receptors, memory loss, confidence loss, and low sexual drive. In the late perimenopause, where your estrogen levels are dramatically declining or absent, you will experience vaginal dryness, vaginal itching, painful sex, urinary problems, muscle aches and pains, thinning of the hair, thinning of the skin. And for the postmenopausal women, now that you are already aging factor comes in. This is where hypertension comes in, joint stiffness comes in, osteopenia, osteoporosis starts coming in. So remember, with or without symptoms, all these changes are due to a drop in estrogen levels. However, these changes occur not only during perimenopause, but extends well into the climacterium. Remember your climacterium: perimenopause, menopause, and postmenopause. So, case number 3, 58 years old. loss of energy, including hair loss and dryness. She feels weak. She presents with palpitations, headaches. She feels like a candle just burning away and waiting to disintegrate in this world. Burning sensation and feeling of mahapde over her intimate part with extreme vaginal dryness. She cannot explain the generalized feeling of vaginal itchiness. No vaginal discharge at all, but she just feels dry. She uses lubricating jelly during sexual intercourse, and despite exercising and dieting, she feels fat, and fat is centered in her hips and belly and never seems to go away. She is currently hypertensive with occasional joint stiffness with increasing pelvic and lower back pain. She complains of leaky urine upon laughing, sneezing, or carrying heavy objects. What does our patient have? Our patient experiences late perimenopausal symptoms. That is the genitourinary syndrome of menopause. The drop in estrogen around menopause leads to vaginal atrophy, the drying and thinning of the vaginal tissue. And this results in an overall feeling of vaginal tightness during sex, along with pain, burning, or soreness. There's vaginal dryness, vaginal itchiness, vaginal discomfort, and urinary problems. Discomfort in passing urine, experiences frequency and urgency, unable to hold the urine, and burning sensation. This is the vicious circle of vaginal dryness. Since the prominent complaint of a woman, whether you're sexually active or not, is decreased lubrication, that is because the lining of the vaginal canal is now thinned out and atrophies. So there's general vaginal dryness, natuyo na. So this is a drying effect due to the lack of estrogen. And therefore, it starts itching. You have pain, you have discomfort. And in women who are still sexually active, it becomes a painful sexual event. And it results in low sex drive and declining sexual activity. I'd like to let you know that, remember what I said, the amygdala is that part in the brain that is responsible for your sexuality and the increase in libido. So that is highly affected at this point. Studies, however, show that women who remain their sexuality, who remain sexually active during the climacterium period, suffer less form of vaginal atrophy since it simulates and stimulates activity of the vaginal glands, improving the blood circulation in the vagina, thus increasing lubrication and secretion. That's why I recommend to my patients who are postmenopausal and whose husbands are still sexually active to engage in sexual activity. But of course, because of the vicious circle of vaginal dryness, there is still need to help women who experience these. Okay. So, your vaginal, okay. For those who are not sexually active, okay, this is what happens. For the celibate, the widowed, and those who are single, you may not have those vaginal dryness or vaginal pain, but you may experience urinary symptoms because your urinary bladder is still found within the vaginal canal. And that is very close to the vaginal opening. And therefore, if that area is also dry and atrophies, it will also affect your urinary bladder. Okay, and that is why you have urinary symptoms. You have burning sensation. So because of the lack of estrogen, you have that burning sensation, you have loss of bladder control, you're unable to hold your urine, you have discomfort in passing urine. Take note, you don't have a UTI. It's a discomfort in passing urine. You may have the frequency and the urgency. And sometimes you may even think, bakit ako naihi-ihi? Wala namang, hindi naman madami akong inihi, pero ihi ako namang ihi. So this is an example. And it is important to understand that urogenital problems are very common in menopause women. But only 40% of women in the late perimenopause will only consult their doctors. They will always have a urine test. Sasabihin nila, naku, nagka-UTI ako ulit. Pero pagdating ng when the urine results come, you don't have a UTI. The reason is, it's a urogenital problem. It's because it is dry. Okay. It is interesting to note that urogenital problems are very common. So those women who are experiencing this, you know the reason, and now you know what are the possible solutions for this. Now, let's go to the natural process of aging. I talked about the natural process of menopause, why it occurs. What about the process of aging? Because when you reach a certain crossroad, it is not only menopausal symptoms that will be responsible to what you feel, but also the aging process. Okay, look at this slide. On the left side, you will have the younger skin. Underneath the skin, you have what you call the dermis. The skin is the most evident part of the body that is affected by the natural process of aging. Look at the aging skin. Underneath the dermis, what do you notice? The collagen, okay? This actually is the structural framework of the skin. It provides a foundation upon which all the outer layers of the skin is anchored. While elastin, which are the green balls, excuse me, your elastin is not as plenty as collagen, but are insinuated in between your collagen fibers. And it is your elastin that provides the softness and the elasticity. It becomes supple. It stretches. It allows the skin to stretch and returns back to its original shape. If you press your skin, okay, or your cheeks, I mean, it will go back to its original because you have collagen and elastin fibers here still in your face. I assume in your face right now. But what happens in the aging skin? Take note, nawawala na ang collagen fibers along with your elastin. So what happens? I'm sorry. So what happens? It folds, it wrinkles, and it no longer looks puffy, firm, and the shape has already has disfigured. Over time, aging will deplete the skin because of these key proteins. Now, I love this slide and I will keep repeating that each woman has two faces. Okay, everyone, get your face mirror, get your selfie, get your cell phone. Look at the face that you see right now. And remember, you have two faces. One that you see right now and one face that you don't see right now. That's hidden below. And it is unknown even to the wearer. Take note How do you look right now? I'm sure many of you try to defy your age by putting a lot of moisturizer, a lot of skin, whatever machines or what, just to defy your age. But what about your face down there? How does it look? Does it look like this? A youthful vulva? Where estrogen, the primary female hormone, is able to set its growth and keep it healthy, keeps the vagina, the vulva moisturized, elastic also at this age. Is it as youthful as when you were young? Because it is well supplied with blood. As your estrogen levels decline during menopause, so with your vulva. Your vulva now will show wrinkles, folds, not only because of the lack of your estrogen, but because of the lack of collagen and elastin, the protein fibers important to keep the form and the function because of aging. So the natural process of aging will make her vulva look like this. Vulvaginal dryness, the loss of muscle and vaginal tone, pelvic relaxation, and reduced vaginal secretion. Furthermore, more often than not, aesthetic imperfections appear. This results in hypertrophy of the labia minora, sagging vulvar labial skin, and even discoloration. So this is not from menopause, but this is from the aging process. What else does the natural process of aging do to us? Our skin becomes dry, it becomes flaky. There's the appearance of sagging facial wrinkles. There is thinning of hair and brittleness of the nails. There is always more often, dryness of the eyes. And we have prominent veins and even aging spots. The cessation of female hormones plus aging will have profound effects on the human body itself. The contour. Before menopause, body fat was laid down on the hips, thighs, and in the bottom, which could easily be reduced just by exercise and even by dieting. However, after menopause, fat now is concentrated around the waist, the abdomen, and even the breasts. As we even grow older, our breasts now tend to sag, flatten, and even lose their fullness. So, my dear ladies, remember, our bodies go through the spectrum of changes with or without symptoms. No early symptoms. Sometimes you may have no symptoms, but you may have, excuse me, urogenital problems. Other changes may become apparent in the post-menopausal phase. So, I think I have made it clear that our body is dependent on hormones for its function and its nourishment. And estrogen insufficiency and decline in its production will affect every part of the body and may lead to a range of symptoms: brain, heart, reproductive system, and the bone. Fortunately, no one woman experiences the whole range of symptoms, but some will have a few and some may not even experience at all. It is important to understand that falling levels of estrogen during menopause plus the natural aging process will result in a decrease in your heart and your bone health. And this is normally seen in women who are over 60 years of age. These women are most vulnerable. Estrogen has a protective role against heart disease. What is known is that irrespective of age, women, even with functioning ovaries, are less prone to heart disease than women who have gone through menopause naturally or after surgical removal of the ovaries. The risk of heart attack or stroke is 2 to 7 times greater in a woman who had surgical menopause before 35 than a perimenopausal woman with intact ovaries. Early postmenopausal phase heart disease, where estrogen levels have gone very low, the heart becomes less efficient and becomes more vulnerable to disease. And the earliest symptom of postmenopausal heart disease is always angina. That is a crushing pain in the middle of the chest brought about by effort and alleviated by rest. This is a warning sign. And when you know that, it's time to see your doctor. Blood cholesterol normally increase as you age. And so with menopause, there is an increasing tendency to have an increase in your bad LDL cholesterol and a decrease in your cardioprotective HDL cholesterol. What about estrogen's role in the bones? Estrogen promotes the absorption of calcium from food. It promotes the absorption of calcium from the blood into the bone, inhibiting bone loss. So estrogen, therefore, has a preserving role in the bone. Remember, estrogen has a protective role in the heart, while estrogen has a preserving role in the bone. Osteoporosis is the single most important health hazard for women past menopause. Aging is the main cause of osteoporosis. Women may be unaware that they may even have it in the early stage of aging because you don't have obvious symptoms. So when the body now is deprived of the effects of estrogen after menopause, the rate of bone loss becomes more rapid, and you can lose as much as 7 to 10% bone mass in a year. So by the time you reach 80, you could lose as much as 40% of your bone mass. Osteoporosis. Okay, ganyan ang mangyayari pag may osteoporosis na. Parang humihina na. You become porotic. The bones become porous. That is because of your low estrogen levels, your decreased calcium absorption, you lose bone mass, so the bones become brittle and porous, and aging is the main cause. So I did mention by the time you are 80, you can lose as much as 40%. So what do we do? Now that I mentioned all the natural process of a drop in your estrogen, the natural process of aging, what do we do now? One pressing issue is this. Shall we take hormone replacement therapy? What is hormonal replacement? It is a form of drug therapy where we replace estrogen, okay, because the ovaries are no longer making these. HRT prevents the long-term effect of bone loss. It prevents osteoporosis. When you take estrogen, you take calcium and you exercise and combine it with vitamin D, you may prevent osteoporosis. Women who take estrogen after menopause have a bone mass of women who are 10 to 12 years younger. So you can still dance, you can still do the samba, and you can even do your exercise. It is important to understand that treatment, there is no one drug fits all. It is crucial that your doctor will customize, individualize with all the symptoms, with all your concerns and issues have to be laid down so that your doctor will understand what is the best solution and alternative to address the concern. There are oral and vaginal hormonal replacements. It is important to understand that as long as you still have your uterus, you will need to take hormonal replacement therapy that contains both estrogen and progesterone. If, however, you no longer have your uterus, all you need is estrogen replacement. Oral hormonal replacement therapy is highly effective in combating physical, emotional symptoms because it's easy to swallow, it's affordable, it's convenient, and offers a very high level of protection against osteoporosis. In addition, those who complain of vaginal dryness, those with late perimenopausal symptoms may conveniently use local vaginal treatments, estrogen treatments for vaginal dryness, irritation, urinary incontinence. Remember, this will not treat hot flushes and will not prevent heart or bone disease. For bones and osteoporosis, there are available oral medications and injectables, biphosphonates, even medications, denosumab. So it is important to have a baseline bone densitometry to see the level at which your bone health status is. Now, for women who want to restore and feel good and empower themselves, and not only that, relieve their genitourinary symptoms, they want to have a total intimate makeover, they can undergo a total surgical vulvovaginal restoration for both functional impairment and aesthetic imperfections, as seen in this 65-year-old woman who wanted to empower herself. She looks very young, but she knows that her face down below has aged way beyond what she actually looks currently. So this is how she came to me. Post-operatively, it became youthful and restored. 6 weeks post-op, she is a new woman. And for those who also want an aesthetic and functional change to tighten their vaginas and offer changes in their look outwardly, may undergo aesthetic procedures and may have this youthful looking vulva restored, and therefore not only you will be pleased, but also your husband. And for those women who do not need surgical intervention and who do not require or are not interested, this is a very important alternative solution for those who complain of vaginal dryness, vaginal looseness, and a lack of insensitivity. Non-surgical vulvovaginal restoration, radiofrequency, delivers heat deep into the tissues, into the vagina, where warm heat massages the area that is being treated. Take note, since there is a lack of estrogen, there is a lack of the blood supply, your vulvovaginal restoration from the temperature-controlled radiofrequency procedure will increase the blood flow to the impaired tissue, stimulating, again, hindi to menopausal symptoms. This is from aging process. This will stimulate new and tighter collagen and elastin fibers. It will not only improve tightening or thickening, but will improve moisture and lubrication and friction during intercourse. So, does life really begin at 40? Tell me. Now that you understand the process that you have actually gone through, it seems that many people, particularly the young people, actually associated growing old with being miserable, because you forget your glasses, you forget the names of people you just saw, you forget the name of the actor, yung artista, yung title ng movie na pinanood nyo, and then now you have grandchildren. The young people think it's a doom and gloom. But on the contrary, new research now shows that the new 40 is actually now the age that you are in. Old age is not associated with the decline in happiness. In fact, older people are just as happy as younger people. Research shows now that life begins, the new 40 is actually 60. Because at 60, you are happy, you are, the number of years that you have gone through have made you bolder and wiser, and you are now more experienced. So, is it a doom or gloom that you are in now? For women reaching 60, 70 means that there is now a discovery of newfound freedom. Look at this woman. Look at these. Life offers us so much richness every day. There is no need to look beyond the growing number of years, even with faulty eyesight and visual acuity. Right now, you may be 30, you may be 40, you may be 50. How do you look at life now? All we need to do is to have a good laugh. Laughter. Look at this lady. She just laughs. Laughter is the best medicine. Studies have shown the louder you laugh, the more days you add to your life, because it boosts your immune system. It improves the blood circulation. It improves mental alertness, and it gives you inner peace. Thanks to the advances in medical care, it means no longer that the life expectancy is 80. It can even be 85, 90, or even 95. We can live longer than before. But let's all pause and think for a while. Does that mean that we are getting younger at heart? Or does it simply mean that we are older for longer? So before I end, this is my advice to everyone. Life does not begin at 40, nor does life begin at 60. Life begins now, right now, as I talk to you, because now you understand where you are. I want you to remember that age is only a number. Remember the letters of the word age, A-G-E. Whether you're 30, 40, 50, 60, okay? A stands for acceptance. You will pass through menopause. You have gone through menopause. Whether you're 30, you're 40, hey, you've survived and you've made it with flying colors. Let's be candid about how we all feel. A is acceptance. You will pass through this. Everyone goes through the same situation, but in different degrees and in different ways. But basically, you are not alone. Physical changes are happening now, and it will soon be there for the young ones at 40. And it is still now, it will even get worse. But all we need to do is to accept the seemingly harrowing, intimate dysfunctions that we currently experience. Remember, acceptance will always provide a solution to these experiences. The next letter is G, letting go. Letting go means freedom. That is discovery of newfound freedom. Whether you're 40, whether you're 50, whether you're 60, the new freedom is me time. There is always time for me, myself, time for self-care. You don't need to wait when you're 60 to have time for your self-care. You don't have to wait for 70 until you feel you love yourself. Now is the time. Positive vibes result in the renewal of spirit, restoration of whatever physical changes that you experience, and a total rejuvenation of yourself. Me time means more travel time, anywhere, you can go anywhere, freedom to do what you want, and freedom to just have quiet time at home. Your home front will be organized. Yes, it could be less financial burden because by the time you reach 40, by the time you reach 50, your children are already into college. They'll be working. So there's going to be less stress, okay? So, and for those grandmothers out there, it's me time because there's pleasure of grandchildren without the responsibility attached. And for those who are experiencing currently dual citizenship because of the senior discounts, that's a newfound freedom. You have a lot of discounts. So it's time to stop worrying about trivial, petty things. And for the letter E, this is my most favorite. Experience. Experience never grows old. There is no substitute for the number of years behind us that have made us bolder and wiser. Experience never grows old simply because it is a way of life, just the same way that we all welcome the rising sun each morning, and we are always grateful for the day that has passed. Right now, it's already sunset. It's already 7:38. It comes with more wisdom and more security. And experience gives us a better perspective of how we are aging. All we need to do is laugh. All we need to do is talk about it. All we need to do is live about it. We have better relationship with our friends, with our husbands, with our children, and we even continue our long-time friendships. Luckily, it's not all doom and gloom. For many of us, right now, life begins now with this newfound freedom. However young we may feel, there is no ignoring the fact that aging is inevitable. We have gone through the roughest and the toughest times of our lives, but we are now ready to face the new life that is set before us. We have to start now. And we have to change the ending of our lives and believe, understand that the best is always yet to come. So the quality of life that you will have from now on belongs to you. The choice is yours. Do you want to have a life like this? Or do you want to have a life like this? ready to face the new life that is set before us. So start now. Change the ending of your life. Always believe that the best is yet to come. Always start and think now. And to me, this is my biggest share to all of you. I found the greatest freedom. I am 64, but I feel young. But I feel my life has just begun because I have come to the understanding and appreciate my mortality. And I think the greatest freedom for each one of us is the spiritual nourishment that draws us to come and understand that aging is inevitable, but our Creator is ageless. We have a God who is ageless and who will love us without question. So my take-home message to all of you is Isaiah 46, verse 4. Even to your old age and gray hairs, I am He. I am He who will sustain you. I have made you and I will carry you. So this is the newfound freedom, my dear friends. And this is the newfound life that I think that each one of us are ready to embark in. So thank you, everybody. Thank you for listening. And I